So continuity is really important to have that continuity, and also I highly recommend that you have a coding, because there's times when, like for instance, I was at school the second year we did it, and I was having and then so it's nice to have somebody that can step in. Yeah, definitely. So what we do is we're really controlling the biohazard waste because we have to pay premium prices for disposal. So we tell the hygienist only an extremely soaked blood-soaked gauze gets put into our receptacles. We use these orange buckets. I don't know if those are from Mom.
No, actually, you guys provide those.
Did we provide those? Okay.
We've arranged to have the cardboard ones from Enteric.
Oh, okay.
So we're set on that.
So yeah, just to have it be color-coded so that they can really differentiate, this is not going into the bucket. This is not going into the bloody bucket.
Okay.
So everything else, I just encourage them to turn their glove inside out and throw it into the wastebasket, for saliva and such like that. Another thing about controlling cost would be pre-measuring the Paradex. I know the first year we put Paradex bottles out, and we ran out of Paradex by the end of the first day. We had none the second day. So I'm really being careful about just putting here. I'll show you this much. That's all you put in there. I mean,
not much.
Not
like
much.
a mouthful.
It's just a
like
tiny
a
little mouthful.
tablespoon.
And we also pre-measure the C to K and C to light.
Let's go over here and. Okay, here we have the pre-measured chlorhexidine.
Yeah, these are, you just screw these onto there, and we stop at 0.2 mil. And actually, if you're using it as one package, and you measure every single one of these at 0.2 mil, it's exactly enough to do the full package. And you won't run out of tips or syringes. So,
what?
I'm on video.
No, you can talk. Go ahead.
Oh, this is my husband.
Oh, your
What?
husband. Oh, well, yeah. Oh, and here's her husband.
Oh, I don't care. This is Alaska.
Okay.
Have you already done anesthesia?
No, I have not done
Okay,
that
so
yet.
you're
We'll go
next.
there next.
Dr. Julie's going to come and get all
Maybe you should go snag her some food so that she can have something to eat.
Snag me some food and just stick it over. Honest. Okay, so over here, we have a little section here where we just have some red coat disposing, some hurricane. People really haven't been using these, but these are really handy, so I have plenty of these gum. And I have the wide and the super skinny ones. Also the Butler floss threaders. So those are they're here for people available. And we kind of just set up these hot dog tray doodad things. And sometimes somebody will drop a syringe tip or a saliva ejector, so we have like extras. And then if we have to break into a case to get another, for instance, fluoride varnish brush, then we just leave what's left of it here so people can pull out. It's good to have some 4x4s because if the person's really bleeding a lot, it's good to have them. Yeah. And so what we do is we have this setup where we have a tray cover, a chair cover, and then we put these kits together with one of these hot dog trays. These are all pre-packaged by Patterson. They're wonderful. It's all the disposables. And you just put them in here, and you add an ultrasonic tip, insert, and a nose cone, and a cassette. And so the cassettes have this as an instrument setup. It's a Mirror Explorer Pro.
Right.
Yep.
We have pictures of that. Very good.
Yeah, and there's a posterior sickle, a set of Gracies, and a universal curette. So it pretty much does everything. The only thing is, I can't tell you how sharp these are. I don't know who sharpens them.
Should they bring their own sharpening stones?
That would be a good idea, but they have to be done as they open them and then keep it sterile all day. You know what I mean? They can't.
Oh, so right. So they'd have
they
to
can check the instruments. That's a good idea. They can check the instruments, and but there is just not a lot of time to do, and most of it is ultrasonic agreement with the Captron. Now, Mission of Mercy Mom, a mom. They're the 80 CF units, and I'm getting really good favorable reactions from the hygienists. They really like using these. I haven't used them myself on a patient. Sue did. Did you? She used what I think.
So does AMOM provide sharpening stones or anything?
No.
No. Okay, so if they want to sharpen, they're going to have to bring a
Yeah,
stone.
that
Okay.
might be something that we can look about doing in the future because they
Okay.
can provide some sharpening stones.
Well, we can probably round up some sharpening stones, but yeah, I guess the big thing is that they have to sharpen them after they open and keep it clean. Okay.
Right after, yeah, and
Right.
then just keep everything
Okay.
alcohol off. No. Oh, do you have a question?
No, I thought you had it.
No, I just no. You should be doing this. She's been doing this every year too. So. All right, Sue.
What?
Okay, well, okay. Talking about train setups. What else? Tips. Oh, the runners. Okay, let's talk about how we utilize our runners.
Runners?
We do them in teams. So we have when a hygienist holds up a red card, that's their signal to boom. The quicker they get that unit turned over, the more patients we can see. So one person goes in with hydrogen peroxide. This is the enzymatic flush for the suction. And they take the dirty instruments away, suction, take the dirty instruments away to dirty mom instruments.
Dirty mom, that's where the dirty instruments go. A short distance away.
And then I encourage the hygienist to just, if they want to do something, they can just have a side down their chair and light, and then the second runner will take the clean instruments in and set everything up so that the patient.
Oh, so you have the runners functioning kind of as dental assistants.
They're doing yes.
Are you guys
Not
students?
necessarily chair side, but they do the
Students from
turnaround.
where?
Yeah. I'm from PCC.
Okay, so you guys know a little bit about infection control. So the runners actually are not running all over the clinic, they're running instruments.
No,
They're in
and I
department.
I
And
think
also
they-
the red card activates the escort to bring a patient for the hygienist. At the end it says patient exit and it's red, but it also activates your runners.
Okay.
So I instruct the runners to look for that red card, and the hygienist, if they don't get a runner but they get an escort, to continue holding up the red card and make eye contact with your runners.
Okay.
That's an area that can be kind of confusing, but if your hygienists know that this is activating both the escort and the runners, then it goes more smoothly.
And we
Yeah.
encourage them to hold it up high. And also, a lot of times, people will just take it like this and hold it up, and then they can't see it from all sides.
Okay.
So it's good to
The
just let it
individual
hang.
card.
Yeah.
Yeah.
And
Okay,
then when
that's
they're
a good
ready
tip.
for a new
Front and
patient,
back.
when they're ready to have somebody, they put the green card up, and the escort will bring a new patient in. That means they're ready to go. They'll start going right out of count. Then we have some translator cards. R for Russian, B for Vietnamese, S for Spanish. And we also have a technician card. So if you have a technical issue, if your motor stops working, what are some of the things that happen? The ultrasonics might be snafuing.
The prophy angles are a big issue.
Yeah, the propionate. Tell what
Yeah, I've done a lot of that, and usually one of us, it's good for you to go around if there's prophy angle issues to try the different things. Try a different plastic prophy angle, try changing the cone out, or try changing the motor. And if none of those work, by changing those out, then contact the technician. Okay. And then it's beyond what we can do. But that's been probably the most common technical issue is with prophy angles. And they are weeding out some of the cone sheets and the motors because they're not working. That hasn't happened a lot. More often than not, it's the little plastic disposable prophy angle that's defective.
Yeah.
There's
Now
the
this
motor.
is a motor, and a
Yeah.
motor gets put on each shift, and it stays on for the entire 6 hours, and then it gets taken off and switched out at shift change. The cone is every patient gets a new cone. This gets sterilized with all this.
Yeah. Something else I might add, it's nice if you can get translators assigned to your department. Otherwise, they're pretty hard to find. I mean, they're kind of scattered all over, but we have a Spanish translator that's assigned to us this afternoon, and it's wonderful.
She happens to be a dental assistant.
Yeah.
She's already
So we've got both
trained dental
there,
assistant.
right. Your runners are really crucial. We love our runners.
Yes.
We love the
Training-
runners.
Yeah,
They
training them
are-
well is critical. Really
Very.
training them well, and finding out one that kind of seems to be taking the lead, so that they can, if they're willing to stay for the next shift and train them and get them up and running, then it saves the lead some time. Yeah.
Okay.
Oh. Yeah.
Okay.
What advice do the runners have?
I don't have any advice. Look for the red card.
Yeah.
Look for the red card.
And then run.
This is important.
That's careful,
Okay.
yeah.
This actually came up yesterday as an issue about what we're doing as a service. We are a mission. We're not doing definitive therapy. Our definitive therapy is full mouth debridement. Now let me get a chart and I'll show you.
Okay.
So I think these are AMOM charts, not ours, but
Yeah,
our section is at the bottom, hygiene completed. And so this is our service on every patient, every adult patient. We do a full mouth debridement. If time permits and the patient would have some cosmetic issues and you want to polish, then you can check prophy. That we also do adult fluoride. We do a fluoride varnish on everyone. So it's really, really important that they remember to check off the procedure so it gets put into the data collection.
And then sign.
And put their name, and they don't, I think they prefer that the name be printed.
It'd be nice to print some of the
And then
handwriting is
this
atrocious.
goes to the escort too, don't to give it to the patient, hand it off to the escort, and they will take the paperwork and the patient.
This clipboard stays with the patient the whole time. And it has the blue pen, which you only ever use blue ink. Now this patient happened to come through a second time because you see they had their primary rooting, their priority treatment was
Extraction of a wisdom
extractions.
tooth.
So that was completed, and then their second priority would be cleaning. So they came back the second day, they had this done the first day. So they get a Xerox copy of this chart, which is going to be blue, which is why we use the blue ink so we can distinguish between what's done right now and what was yesterday. Because it'll be black.
Yep.
You know, and Hygiene was able to maybe direct some treatment out of Hygiene department. We were asked to just write it in here and say per Hygiene department.
Yeah.
And then when they go through patient exit interview, they will know if they have enough time in the next department to take them or not. But they have to go through the
This is
exit
something
interview.
different. Last night they changed it. They said, don't go to the exit interview, go directly to routing.
Oh, routing,
So
okay.
if there is any issue, because a lot of times, those patients may not have even had radiographs because maybe someone did a cursory examination visually, triage, and you think, hey, it looks good, let's get the teeth cleaned. And then they come in here and the patient, maneuvers their mandible and all of a sudden, oh my gosh, the distal buccal is bombed out. And so that's happened 2 or 3 times.
Yeah,
and so with that,
that's happening a lot.
So those patients would take the chart. As soon as you're done with your procedure, you take the chart and the patient right back to routing because they need to get another procedure card. And we were skirting that issue yesterday, and we got really. Sue missed the debrief last night, but we're like, no more of that, because we all want to try and get as much done as possible.
Sure.
With bleeding hearts. So you were there, right, Julie? You were
Yeah.
there last night.
Yep.
So just stick to the protocol, and everything runs well.
I know that's the key. Stick to the protocol because I've heard that people kind of sneaking in the lab and it's like.
And be
I
flexible because it can change.
I know everybody wants to do as much as they can and.
Yeah.
Yep.
Right.
Oh, I just heard a brain fart. I was going to say something.
We can order an X-ray from here too. Also,
Yeah.
like if they uncover something and it looks like it needs, it would be a purple card.
The purple nomad card.
Yeah.
Right. So I'm not sure if they are looking for us to hold that up.
No, I usually have.
Yeah.
And so your closest
Yeah.
nomad is probably over in Pedo, so you probably have to send one of your runners or
We
something.
also added.
There's also,
We added a new volunteer information booth this year that we didn't have previously, and that's been nice to just kind of a central area where questions can get asked and they can find the appropriate response for you. Also, medications, like if you have a patient who's sensitive, we couldn't even give them Advil yesterday. We had to have a doctor come over and sign the medication order, and then I had to take this over to pharmacy to run medications over there, and they filled it for them there.
Okay.
I know the technicians will ask us to inform our hygienists that they're going to shut down suction or water periodically,
That
but
happens
it's
every
very
day.
quickly, like for 1 minute.
Okay.
And that'll happen. So we
Yeah.
just go down the line and just warn them.
Yeah.
I like to say it's really nice to have 2 leads because I kind of float down and just say, if you guys need anything, kind of take care of our hygienists. I get them tucked in and make them feel comfortable. And, I enjoy doing that.
So I know our hygienists were planning on one person being the lead and then the other one actually working. So do you think that's too
That's what they
ambitious?
were planning to do?
Yeah.
Like working on patients?
Yeah, but okay,
Like
Anchorage is
one
not the
word,
same
so-
kind of a metropolitan area. Maybe you guys are going to be more like Medford, and that would totally work in Medford because it was a small mission, like Salem was doing.
We're doing 100 chairs.
100 chairs?
Yeah, you want to come to Anchorage?
How many for hygiene? Do you have 22?
Same amount.
Same amount. Well, then you need 2 leads.
You
Okay.
do, and one shouldn't be working on patients, honestly, because
There's
Okay.
too many fires
it's
to
a
put out.
marathon too. I mean,
yeah.
this is 3 full days, and you need to be able to give each other breaks.
And you need, we were here setting up the first day, and it's very, very task intensive. And also, I highly recommend good springy shoes. I don't know where you're, are you going to be in a
Let's
on
see
a
your shoes. You
wood
told me
floor?
about these the other. No, we're on concrete just
Okay,
like this.
concrete floors, you're gonna get shin splints. So I am so comfortable. I have been in screaming pain by the middle of the first day in past years.
These are
I
really
don't feel
working,
anything.
huh?
Oh yeah.
Awesome.
In fact, Mel tried to steal them from me. My husband has some. So yeah, they're called Hoka. Hoka. Hoka.
Well, now she's marketing for a shoe company.
Yeah.
Okay,
Yeah.
that's good.
But you feel like you're on a little trampoline. It's like a little pillow on your feet. So you won't get shin splints, I guarantee you. Because I am very prone to shin splints. Encourage, communicate with your hygienist before the mission starts. Like I like to write a welcome letter. We write a letter together, but we say, hey, this is us. We can't wait to meet you and look forward to this, and it's going to be fun. And just let them know that it's a very emotional thing for these patients to go through, and that they will see, they have the capacity to change lives, and it's such a powerful thing. I just really kind of set them. I get goosebumps when I really get into this mission work. We also have a licensed massage therapy school here on site.
I saw that. That's David's favorite thing.
So we can give our hygienist a break and say we'll have a massage if we have good coverage. But in addition to that, if I'm not doing anything, a lot of times I like to go around and just, give them some TLC. And then, every hygienist that has ever worked there has said, I can't wait all the time. I want to come back. And we just call it catch the fever, catch the mission of winter fever. And they just love it. I don't know, what else? What did I forget? I'm very anal retentive.
I see you have a blood pressure cuff in your department. That's probably good to have that extra.
So I like they give us all this paperwork, but I really like to have a nice visual, so I make these spreadsheets up where, I color code it. So green means there are multiple shifts, so that I can make sure that somebody that's green here has been already trained possibly. Our wait lists are down here. And then we have people will come in, or else I will recruit somebody from radiology, for instance, if we're short.
You have a question behind you.
You can see. Oh yeah. Okay, I'll be here. Okay, we have somebody that's just coming on shift, but she's a little bit late, so she didn't get trained. I just keep track, and then for the final shift on Tuesday, it's very important because we do that breakdown thing. And did I already talk about capaciting everything down?
Yeah.
Do you know
Well,
about that?
I know you capacite. So you're talking about breakdown. Everybody here has to stay and help break down on the final shift.
Yes, but the thing is if there are any sterile kits or packs, like if there are any nose cones or any of these, they have to be every square millimeter of surface capacited down before it's returned to our sterilization.
Sterilization told us about
that's
that.
That's why at 2 o'clock I'm going to say stop over here, because we'll just get it as we need it. Like, because patients will start dwindling down. Oh, I already talked about how I did these, right? But
okay, there's your box of extra
these are
pre-made supplies.
Yeah, these are all pre-made, and the first year we did this, Sue and I did an
assembly line?
Assembly line with about 25 people, and there was 25 little products in here, and everybody was just like boom, 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 and we were putting them in these and putting a patient napkin over them. And this is such a better idea, is to get them in a Ziploc, so they're just. And Patterson did this for us. I mean, bless their heart. Sonia over there has a little boy named Cole, and he's so cute. So he said, no, I did a lot of those. So she was very instrumental in getting us off the ground. But I already talked about you don't need scaling and replaning. We didn't talk about that yet. No. Okay, this is really important because, we want to do definitive therapy, and if we see that there's somebody that has periodontal disease and there's deep pockets, to say, well, this is just the start. You need to have 4 quarters of scaling and replaning. So it's very important that you don't say anything like that to the patient, because we ran into some problems, and other moms have had terrible problems by inferring that we've only done a partial job, because some people are very demanding. They say, like, well, I'm not, why I came here to get this done, and so you just want to avoid that problem by saying your service today is mouth agreement, and that is our therapy. So we don't offer anything else in the mission. No. And Connor is a friend that I just recruited.
Here's Connor.
He's
bringing
applying to
us
dental school.
Oh,
so, yeah.
Congratulations.
Thank you.
Yeah.
Glutton for punishment.
Yeah.
Good for you.
So I talked about the pre-rinse. That's about it, I think.
Okay.
guys, you're welcome to call me or email me anything
And I
you
have
need. So.
I have your
You got my contact
information, and so we'll contact you. So we'll just take
Yeah.
there's a hygiene department working away. Actually, one thing you could talk about real briefly is that on the first day we noticed that it was real slow here, and now you guys are
That's
screaming
what I wanna
busy.
talk. Monday morning, the day one morning, you don't need a full shift starting at 6 o'clock in the morning because they show up about 5:30 and I start training about 5:30, 5:45. They can get a bite to eat. But seriously, we only had maybe 5 patients for the first hour and a half, and people were standing around, and it's very demoralizing to have gotten up at the crack of dawn. So maybe you want to have some people come at 10 o'clock or 8 o'clock, but not everybody come at 6 o'clock. Because I would say it wasn't until 11 a.m. that we had people in the waiting room, which was just horrifying to me because I'm thinking, oh my gosh, we had so many hygienists, we had a waiting list, people wanted to sign up, they couldn't. And it's like, they're going, I want to work, and you know, there wasn't any patients for them. Because, of course, the emergent care is all, they're going to be going to EXO and they're in pain. That's why they're spending the night in line like that. So,
But now
you
well,
can
let's
see.
look at our
waiting room. This is day 2.
day
And
2. That's the
because
waiting room right
people
there, and every chair is full.
Yeah, they're coming back. They've had some treatment in restorative yesterday or possibly surgery even. And so they're here. They were here first thing this morning. So,
So day 2, you need a full staff.
absolutely. Very, very, very important. Yeah, way more important than day 1.
And then also you said having more than the required, more than the
Thanks, everybody.
Thank you.
required hygienist is okay because they can assist each other and give each other breaks.
Yes, I mean, and you can see that chart that, you know, we were using all of these people even though they were on the wait list. Because look at the boxes that are not checked. Those people, I still don't know. They just never showed up.
Okay.
So you're going to get some of that. Did you tell them about the medical triage yesterday?
Oh yeah, the docs didn't show up?
We had 10 MDs. None of them showed up. So it was holding up everything because we wanted to do all the blood sugar testing and all that before we get to dental triage to see do they have pre-screen for diabetes. And we only had one person that even remembered how to work the lancet and read all that. So it's very important that you get people who are committed and that will follow through with their agreement. So. Another thing that what we ran into is you talked to Michael and Mel about their situation. Previous years they had their own autoclave, and it saved huge amount of work and effort for sterilization because all they have are syringes. So it's like they could just process all their own syringes. And so they were very disappointed that apparently the mom protocol is that all the autoclaves must stay here because they were sharing one between surgical and restorative anesthesia. But it just saved so much running back and forth to get sterile instruments because they're going through them like this all the time, right? So the other thing I noticed was that surgical anesthesia was totally slammed. There must have been, there weren't even enough chairs in the waiting room yesterday, and I had to go over there and help my son get injections because we had 2 leads here, and so they were begging us. We needed more hygienists, and we weren't as busy with the patients here, so we were able to recruit people. And so always tell your hygienist to stay flexible.
I've heard that over and over. Be flexible.
And just have fun. You know, be flexible, have fun, and roll with the punches. And it's so rewarding. We also have patient comment cards in the break room.
Yeah, I saw
Did you
those
see
were great. Yeah.
Some of those are real tearjerkers. It's just really heartwarming to see that. So, any questions? Just call me.
All right.
Yeah, thank you. Have fun, you guys.